Every year, thousands of Kenyans face a silent threat, the venomous snakebites. But now, a new battle is being fought by local authorities, cutting-edge science, and global partners. And this year, the World Health Assembly has joined forces to look at this menace and fight it globally. In Kenya, snakebites remain a hidden crisis. Thousands bitten, many lives lost, and countless others permanently affected.
The areas where people are really affected include Samburu, Kitui, the coastal region, Bere, and Kitui. Yes, and Barigo, sorry.
Snakebites disproportionately affect rural communities and often go underreported. But scientific mapping helps reveal the true scope and hotspots across Kenya.
In Kenya alone, this crisis have affected more than 19,000 people, individuals every other year, and tragically, we lose lives every other day.
The public health challenge is not only the snakebite, but the complications such as disabilities, amputations, and the need for effective treatment options and follow-up.
We are keen on two issues, of course, the public health issues that relate to snakes and snake bites, but really also the complications that come with snake bites, particularly the disabilities, the amputations at the medical facilities, and also on the other end, the pipeline that may emanate from this in terms of manufacturing of anti-venom, because that could also potentially open a lot of doors for manufacturing of other vaccines, for manufacturing of other products.
So the antivenoms that we are currently using are coming from either India or from Europe. And the problem with that is that the efficacy rates are low. So we want to use science so that we can make more effective, more efficacious antivenom. And because of that, then we'll be able to reduce the cost of managing snakebite issues. At the same time, we are going to make it accessible. And you all know that the Kenya government has introduced the universal health coverage. So by us coming up with more effective antivenoms, by us mobilizing resources to come up with products that can address the issue of snakebite, it's going to mean that we are going to be able to achieve the universal health coverage.
Local manufacturing of effective antivenoms promises greater access and affordability critical to universal health coverage goals.
As you know, our president is a manufacturing champion of Africa. So why not bring snakebite and venoming and the creation and the production of vaccines to Kenya? It's something that we can do, and it's something that the whole world needs to give priority to make sure that nobody dies from avoidable death like snakebite.
For now, we have already started engaging with manufacturers. And the idea is that we start with contract manufacturing so that we give formulations for the manufacturing to specific companies. They do that for us for a year. The second year, we would want to start thinking about technology transfer. And eventually, by the third or the fourth year, we should be able to do our own manufacturing. But the starting point is for us to have antivenoms that are effective. And that's why we are partnering with people who are already in that space, so that we can be sure that we're not going to reinvent the wheel. Now, Kenya imports over 70% of medicines and health commodities. And what that then means is that we cannot be self-sufficient. And to change that narrative, what we need is to start building capacity in the country, because that's the only way we're going to be sure that universal health coverage works the way we want it to work.
Addressing snakebites requires not only medicine, but also community engagement and education to prevent bites and ensure timely care.
I think what's most important in this is not only do we have sufficient interventions for snakebite, but it's also can the community now, because many snakes are not poisonous, but can we work with the community to find a solution to lower the incidence of snake bites? I think those are the two things that we came out with is let's try to work with community to lower the incidence, because the solution has to also come from them. And let's make sure that the intervention is available. So it's not just snake, the medication, on the medicine side, but it's also on the attitude side and the work that we do side. So it's how do we work with communities? How do communities also drive the prevention of snake bites? And then how do we use what we have and leverage what we have to really ensure people get treatment quickly?
Experts say that snake bites are not just a medical issue, but a humanitarian and a development challenge impacting the poorest communities at their most vulnerable moment.
So it is therefore not only a health challenge that we are dealing with, but a humanitarian and global development issue with its impact most acutely felt among the world's poorest and economically vulnerable communities. Despite many bold efforts to elevate the issue in recent years, fresh momentum, leadership and coordination will be needed to help achieve this goal.
It would be also important to train and capacity build the frontline workers to help in the identification and prescription for antivenom. Then again, the strengthening of supply chain.
Kenya's snakebite crisis demands combining science, healthcare, and community action.
One of the major achievements of this World Health Assembly Forum is that a global snakebite task force has been established. Now Kenya is co-hosting.
Together, through science, community engagement, and government leadership, Kenya can turn the tide on the snakebite crisis, saving thousands of lives and restoring hope. For Willow Special Reports, my name is Yvonne Kawira.